Hello students. So in this session I will discuss about drugs used for the treatment of chronic gout. So in chronic gout, in between acute attack there is pain and stiffness, and other cardinal features of chronic gout are tophi, which are chalk like deposit under the skin, and formation of urate stone in kidney, and obviously there will be hyperuricemia. And in chronic gout we are trying to reduce serum urate level below 6 or 5 milligram per deciliter. So in chronic gout we want to decrease the serum urate level, and we can decrease the formation of uric acid, or we can increase the excretion of uric acid. So first I will discuss about the drugs which increase the excretion of uric acid through urine. So drugs which increase the excretion of uric acid are known as uricose uric drugs, and we have one such drug known as probenecid. Probenecid, actually uric acid is reabsorbed by urate 1 in PCT, and probenecid blocks urate 1 transporter, so that's how it increases the excretion of uric acid. Now let's talk about other group of drugs we have which decreases the synthesis of uric acid. As we know, uric acid is the end product of purine metabolism. So now look at this chart. So as we know, every cell has nucleic acid which is made up of purines and pyrimidine. Now if a cell dies, it is metabolized into hypoxanthine, and hypoxanthine is converted into xanthine with the help of xanthine oxidase enzyme, and xanthine is again converted into uric acid with the help of the same enzyme, xanthine oxidase. And now we have developed drugs which inhibit this enzyme, and example of such drugs are allopurinol and febuxostat. So what is the mechanism of action of allopurinol? It is a competitive inhibitor of xanthine oxidase enzyme and the drug of choice for chronic gout. And if we talk about its side effects include hypersensitivity, especially with thiazide diuretics and ampicillin. And we have developed another drug which we give when a patient is allergic to allopurinol, and allopurinol is a purine derivative and febuxostat is not a purine derivative, and it has less incidence of hypersensitivity. Febuxostat also inhibits xanthine oxidase enzyme, but it has less incidence of hypersensitivity, and it is not a purine derivative. So if a patient is allergic to allopurinol, we can give febuxostat. And the last group of drug we have is uricase enzyme. So uricase enzyme is not found in humans, it is found only in birds. So that's why birds do not develop gout, because uricase enzyme further metabolize uric acid into water soluble compound known as allantoin. So let's look at the example. Rasburicase and pagloticase. Pagloticase has a longer T half life because we have added polyethylene glycol.